will reserve speaking at this point.
Thank you very much. The next question will be going down to South Africa, to Tamar, Business Day, South Africa. Tamar, can you unmute yourself and ask your question?
Hi there. I think this is a question to the Director General, Dr. Ted. Could you please give us a sense of how many member states have already signed up to COVAX and whether South Africa is among them? And kind of linked to that, could you perhaps comment on what might be deterring or holding up the sign-up of more countries?
Thank you very much, Tamar, especially for raising the issue of the importance of COVAX. And for the others on the line who may not be familiar, of course, that's shorthand for what is the ACTA's coronavirus, or COVID, pardon me, global vaccines facility. So this is a global solution that has been developed to try and ensure as many countries as possible can pool the risks of development of COVID vaccines. As everyone on this call knows, there are many, many vaccine candidates. Many of them are in trials, built on many different platforms in different parts of the world. We simply don't know yet which ones are truly going to protect people against the disease. So a key goal of this platform, or this facility, is to have as many countries as possible cooperate together to be able to pool the development risks, working with manufacturers and others, to pool the investments, and then to pool the procurement and allocation of that product. Because as Dr. Tedros said in his opening comments, one of the things we've learned the very hard way in this crisis is that we can't get out of it alone in terms of the protection of our health systems, our economies, our societies. We have got to get the highest risk parts of the world vaccinated at the same time. Roll that out from the highest risk populations globally is going to be the most effective way to do that. You can only do that, or most effectively, when you have a global solution, a global facility like the COVAX facility. So this facility, this global vaccines facility, there are two groups of countries in it. There's 92 countries, which are a combination of the usual countries that work with Gavi, the Global Vaccines Alliance, and other countries that may need assistance. There's 92 of those. And then there are a group of what we call fully self-financing countries, and there's 80 countries that have expressed an interest. So we have a huge number of countries that are engaged right now in discussions about the Global COVAX facility. The total, as I said now, is over 170, and that represents about 70% of the world's population. You asked how many have actually signed up specifically. Right now, we're still in the process of design. The terms, what we call the agreement terms, which country would sign to join the facility, are just being finalized. We are looking for an indication, a firm indication for countries by the 31st of August. So that'll be the time frame that we'll be able, Tamar, to give you a better indication of who has expressed an interest versus who has actually signed on. Now, in addition to those 170 countries, one of the questions we had since last week is, what about all the other countries? And there are, as people know, the European Union is working toward a solution for the European countries, and some other countries are as well. And one of the other substantive developments over the past week has been a much closer working relationship with these to try and make sure we can all join forces together to ensure the most collaboration possible in the rollout of vaccines, because, again, as the Director General said, the key is not ensuring all people in some countries get vaccinated. That's not the solution. The solution is some countries, or some populations, the highest risk populations in all countries. That is the fastest way to bring severe disease down, save lives, get health systems safe and robust again, and then get our societies fully functioning and our economies working. It's a self-interest of everyone to cooperate together, and the facility is a key piece of that.
Thank you, Dr. Aylward. The next question